Okay, so the question is, should Deb get tested for the BRCA gene? I believe she should for a multitude of reasons. First off, it has the possibility of reducing her risk of cancer because if she is tested positive, she can make lifestyle changes to lower the risk of getting cancer. And she can also do certain treatments that will help her, such as drugs to block the estrogen and growth of the cancer, the removal of both ovaries, which will overall lower her chances severely, and the removal of both breasts, and a yearly physical exam. And those were proven by the documents that were provided to us. Our second reasoning is there's only something to gain. Even if she is tested positive, she would only be able to gain because she would be able to plan her life in a more effective way. If she is tested negatively, it would also be a huge relief to her and her parents. And although her parents would be stressed out if she would test positive, they would still be supportive throughout the process in hopes for her to get better because at the end of the day, Deb is still their child. My final reasoning is that she is already educated. Because she has prior knowledge of being a doctor and she understands what she's getting into. If she were to be tested positive, she would be able to inform others in her family about the situation and let her family plan and lower their chances as well of getting the cancer. If they're unable to pay the expenses of the treatment, there are affordable options and options to lower the medical bill according to cancer.org. Thank you. Do you have any clarifying questions?
So regarding your third claim, what do you mean by Deb's already educated?
As shown in the documents that were provided to us, we know that she has the prior knowledge of being a doctor.
Okay. So regarding the question if Deb should get treatment or not, I don't believe she should. First off, based on the results, Deb would most likely have a lower quality of life. So Deb could find out she's at risk for breast cancer with the results, and that would be good for her to start any treatments and procedures. But at the same time, she could be upset with the results of what she sees, what her outlook is. And next, finding out the risk Deb has on getting breast cancer can affect relations with her family. Her family members could take her getting the tested the wrong way. They may see her as finding out just for herself without just for personal gain without any care for them. And last, if Deb were to start treatment based on results, she could be at risk for losing a lot of money. So Deb could use her results from the test to her advantage and start treatment ahead of time. However, that just results do not tell you exactly if you're going to get breast cancer. So if she were to start treatment, she doesn't know yet if she's even going to get it. It could just be a waste of money and time. Do you have any questions regarding my claim?
Yeah, so for the first argument that you had, you said that it would lower the quality of her life. Is that correct?
Yes.
And the final argument you had was that if she did the treatments, she could possibly be wasting money.
Yes.
Thank you.
So here's why your claims about why Deb should get tested is wrong. Your first claim was about that if she got tested, she would possibly it would lower the possibility of lowering her risk of breast cancer because she would be starting medication examinations. So what if she gets tested and she has an increased risk? What if it doesn't mean anything? What if that doesn't mean it? So if she just sees results, if she just does the medication examination based on the results, she could be wasting a lot of money and time because even though she's at increased risk, she still might not get it. Your second claim was about that the testing would be only something to gain, and it would gain info about her risk and if she has it or not. It would also be a relief to her parents and family members. So first, yeah, it would be something to gain about her risk. Once again, what if that doesn't mean anything? Yeah, you're right about that. She would gain info about her risk, but then if she were to gain this info, I feel like it would just mess her up. And also, you said that it was a relief to her parents and family members. I don't see it as necessarily a relief to them. It would just be more concerned on them as well. And your last one was about how Deb's already educated because she's a doctor, so she would understand the topic the best. But I don't see how this relates to testing and the treating of breast cancer. So the best thing to do would be to just avoid as much testing as possible in order to prevent any damage to herself and her family, whether it be physical, mental, or emotional.
Alright, so one of your arguments that you first presented to me was that if Deb got the treatment, she could be wasting money. However, because she is a doctor, we know that doctors already make a good amount of money. And the fact that I cited from cancer.org that there are affordable treatments, money would not be a valid argument in this situation. The second thing was that it would affect the relationships with her family. I believe that it would to a certain degree. However, because we're talking about family, they should, in theory, be forgiving, because families are supposed to be supportive of the decisions you make, whether or not they like it or not, or whether they believe it or not. In this case, cancer, which could be a life-threatening situation, is one of those situations where they would be supportive. Another thing you said was it would lower the quality of life. If anything, it would increase their quality of life, because she could revolve her life around, avoiding this obstacle of having cancer. And with these treatments, she would be, in theory, be able to live a better life. In my opinion, the best thing to do in this situation is to get tested, because not only is there something to gain out of this, whether it be a negative or a positive result, we can do something about it and be proactive about it. As well as, like I said, it could reduce the risk of you having cancer and living a more better life. As well as that, because she's already educated, she would understand like the precautions she would have to take in order to, live a better life.